I want to talk about drug shortages and focusing on parenteral nutrition. And Dr. Kinberg is going to focus on from a physician perspective. I'm going to focus on a pharmacist perspective, but hopefully the focus is really what you can do as a consumer and a caregiver to stay safe, maintain a safe PN formula. That really is our focus. So I have a few disclosures. I'm going to move this over. Okay, a few disclosures noted there. So first I want to start with the background, just a little bit of a background. I really want to be able to leave plenty of time for questions at the end. So, and I've already taken up way too much time getting my audio set up. Sorry about that. But really, PN shortages have been around for 4 decades, believe it or not. And many of you are probably quite familiar with situations where there have been shortages in the past. But the reason we're talking about it today is because it's just become more and more of a problem, more and more of an issue impacting more and more products. So it is something we all need to be aware of and how to advocate to make sure we're maintaining a safe formula. The reason that the ingredients in a PN are so vulnerable to shortages, variety of factors, but primarily there's just really a small number of manufacturers. You know, parenteral nutrition is not, as you know, a common medication. And so there's really only, in some situations, for some ingredients, there's just a single manufacturer. But, you know, there may just be a few manufacturers. And so when a quality issue impacts a manufacturer, maybe a recall or, for example, the Hurricane Maria that destroyed some manufacturing facilities in Puerto Rico, that impacts the rest of the marketplace where it's harder to find an alternative and to make up the increase of demand. The production requirements to manufacture many of these components are very complex, so it takes time to ramp up manufacturing. So those things make it all very vulnerable to shortages, product shortages. I've listed here some.
Sorry, Vanessa, the slides aren't advancing.
Okay.
It was before.
Oh, resume
it's stuck on the disclosure. There we go.
Yeah. Okay, do you see this one now, the background? Oh, good, thank you.
No, it's good.
So pretty much every ingredient has been impacted. Protein, lipid, electrolytes, really all electrolytes, sodium, potassium, calcium, phosphorus, they have all been impacted by shortages. The trace elements, multi-trace elements have been impacted, as well as the individual trace element components of zinc, copper, selenium. Multivitamins have been impacted. Really one of the first shortages we had to deal with decades ago, and it's still on and off been an issue. So COVID has obviously impacted this, and really why we're seeing increased issues with drug shortages. And when you think about it, not only has there been a shift in manufacturing, you know, you've got the COVID vaccines, the treatment for COVID has all really created a shift in demand for not only things like vials and rubber stoppers and, you know, the aluminum caps within a within a vial, but it's also impacted workforce demands. So there's been a lot of shift of manufacturing due to COVID, as well as the supply chain issues that we all hear about. So those things have definitely impacted drug shortages. So there are strategies available to manage shortages. As I mentioned, it's not a new problem. So we have learned over the years how to manage these shortages or create some strategies. So Aspen provides really good recommendations for this. It's available to clinicians on their website. You don't have to be an Aspen member to access these resources. So it's something to be aware of, that there are resources out there, and we can direct our clinicians to these resources if they're not already familiar with them. Your infusion pharmacy is responsible for monitoring your product supply. So what does this mean? You know, there really needs to be a handle on when supply is running low. We don't want to just run out of product. We want to know, okay, there's a back order of a product. Oh, this shipment did not come in. So we need to have a really close communication within the infusion pharmacy with the inventory and with the pharmacist. So we're all aware of the supply, any potential supply issues. We want to be able to implement rationing measures when the supply is limited. So we want to try to conserve as much as possible, especially for our most vulnerable patients like a neonate. But really, even to decrease a dose may be appropriate as a way to ration supply and really prevent depletion of supply whenever possible. That's really our goal. The other tough thing is to determine or to really know, okay, now when can we resume normal dosing? It's a hard thing to know, because just because you get a certain shipment, delivered, does that mean it's going to maintain supply? Because you really hate to ration and then go back to normal and then ration again. It's confusing to you as a consumer. So really knowing when to then revert back to normal dosing is not always an easy thing. But your medical team, your infusion pharmacy, and you as a patient are all responsible for dealing with these shortages. Identify appropriate alternatives and really make sure everyone is in communication and everybody is aware of what's going on. So what can you do as a patient, as a consumer? There are measures you can take to ensure a safe PN formulation. So that's really the focus and the real take home here. And one of the ways you need to, or one of the ways to help become an advocate for yourself is to learn how to read your PN label. It's really important. And I know it's an intimidating label and not everyone is comfortable with that, but there are key components on that label that it's important for you to know where that is and how to identify those components. So the first thing is to know where, look for the volume. You need to know the volume to infuse and the duration of the infusion. That's all part of the label. That amino acid or the protein dose. Now, it may be a trade name. It may be a Travosol or a Clinisol. So you may not recognize that as the protein source. So you may need to ask your pharmacist, what is this? But that is part of the label. The dextrose dose, which is your carbohydrate source. So that's your calories. Now, lipid is an easy one because yes, it's there on the label, but you have a white bag. It's kind of a giveaway. If it's a white bag, it's got lipid in there. If it's a clear bag, it has no lipid. You may be getting lipid every day. You may be getting lipid 3 days a week. You may not be getting any lipid. That's one of those optional. It will vary based on your prescription. The electrolytes, so those will be listed as a salt within the label. And, so you've got those separate components and then the dose. So that's important because let's say, we've been dealing with a calcium shortage, for example, and if you don't see calcium listed on your label, are you on an alternative calcium? So that's why it's important for you to see what's on the label, because you may have a pharmacy who they couldn't get the calcium and they just didn't put it in your bag, but you need to know that it was omitted. The micronutrients would include your vitamins and trace elements and those components. So those trace elements may be individual trace elements, or they may be part of a multi-trace element package, so maybe a trade name, but you need to be aware of what's in the bag. And then that expiration date, or what's called a beyond use date, would be also an important component that you need to know where to find that on your label. So this is an example of kind of a sketched out label of what you would see. Typically you've got a weight on your label, and where I have an asterisk like amino acids, lipid, multi-trace elements, multivitamins, those are typically ordered or listed as a trade name. So you need to kind of be familiar with those trade names and really kind of look and then compare with each week's delivery, is there a change? This is, or I anticipate a change. So you can kind of look for that to see if it's changed. But this kind of helps you then become an advocate to know, okay, there's something that looks funny, or I don't understand this. And so then you can call and find out and ask. So learning how to read your PN label allows you to then look for changes or omissions of an ingredient, which is very important to know. Ask your infusion pharmacy if you think something is missing. Make sure your healthcare provider prescribing your PN is aware of any shortages. That whole communication is so important. And I will tell you, from a prescriber perspective, I sometimes find out from my patients that something is missing and I was not contacted as the prescriber. So don't just assume everybody knows. It's, I think, important to make sure everyone is aware. And then finally, and really most important, is there an alternative plan in place? There needs to be some type of an alternative plan, even if it's increased monitoring. What impact does that shortage have on you? And this is where I'm going to turn it over to Dr. Kinberg.
Yeah, so thank you, Vanessa, for sharing the perspective from a pharmacist. As Vanessa mentioned, we all work together as a team, and you, the consumer, the caregivers, you are part of that team. So I'm hoping to give you some insight from the healthcare provider standpoint. These are my disclosures. So as a healthcare provider, how do we manage the TPN shortage? So first of all, we don't always find out before you do. So sometimes it's actually on social media, some of these shortages, or some of my patients' parents will contact me before I even know that there's a shortage or a component is removed. And part of why this happens is because usually there's a lack of notification to the companies themselves, and things kind of are rushed to try to get things done. Sometimes they forget to let us know. We also work with several different home care companies. This has been compounded recently with the closure of some of the bigger companies that we were using. So there's a lot of care coordination that has to occur. These shortages often happen with multiple products at once, and they're rolling shortages, meaning once one product is out, there's an increase in demand for another one, and then that one becomes out of supply as well. And we have to frequently rewrite the order. So when you have to change one lipid formulation to another, amino acid to another, or make changes to the multivitamins, new orders are needed to be provided to the pharmacist at the home care company in order for us to keep up with the shortage of the week. And you can imagine that that can lead to errors as we're trying to navigate all of these things. So what are we going to ask of you as healthcare providers? So first, when there are shortages, when there are reductions or eliminations of components in the PN, we are going to ask for increased monitoring of blood levels as we're adjusting this PN formulation. So you may have been on a very stable regimen and had blood work done even once every few months or once a month. And now we might need to check things much more frequently, especially those vitamin levels and electrolytes. And we might ask you to take oral supplements, and I'll touch a little bit more about that in a minute. So I just want to give you an overview of the multivitamins. So this is a recent shortage that we had, and it's still ongoing in many places. So you can see over here just a comparison between the adult multivitamin and the pediatric one. So the adult, this is compared 5 ml. So you can see that the components of the vitamins are much higher in the adult than the pediatric one, except vitamin D and vitamin K, which are higher in the pediatric multivitamin. And just so that you are aware, when we dose the adult multivitamin, it's actually 10 ml of this. So all of these will be doubled. And this is providing you with the fat-soluble vitamins. These are vitamins that are stored by the body, A, D, E, and K. And then the water-soluble vitamins, which are not stored by the body and are easily excreted. These include the B vitamins as well as vitamin C. So what happens when we are not able to provide the multivitamin that gives you all of these things? So you have an overview here, and I hope you can see this, and I'll go through some of it. So what happens when you don't have these vitamins, and why is it so important that we supplement them? So vitamin A is very important for your eyes. In children, it can, if it's deficient, it can affect growth and development. Vitamin D is very important for bone health. Vitamin E is important for preventing hemolysis, preventing numbness. And vitamin K, when it's deficient, can result in bleeding or bruising. Now, if you happen to be on Coumadin and vitamin K is removed from your PN, that might affect your levels of your INR as well. So how do we supplement? So if we're not able to provide these individually in the PN except for vitamin K, so you can see the ones that I start are the ones that can be given individually when the multivitamin that comes with all of them is on shortage. So we want to give water-soluble forms of these fat-soluble vitamins. When you have short bowel syndrome, you often have fat malabsorption, and this will include malabsorption of these fat-soluble vitamins, the A, D, E, and K. So we can give you a water-soluble version of these. One of the most common ones that we use is the DECA's supplement. They have an essential one, which contains just these 4, and DECA's Plus, which contains a multivitamin as well. Or we might be supplementing the components individually. One thing to note, vitamin D comes in a few different forms. D3 is really the one that we want to use. That is cholecalciferol, that is absorbed much better. There are sublingual forms. One of the brands is called Nutrisource, so they do make a sublingual version. The advantage of having sublingual medications is that we have a blood vessel underneath the tongue. So it's as close as we can get to injecting something into your bloodstream. So it's a dissolvable pill that gets absorbed directly into the bloodstream. And then if you have malabsorption, it's not affected by that. And sunlight is very important. We're often sitting inside. You know, we're not going out to conferences, especially in the last 2.5 years, not socializing the way that we used to. And even when we are in the sun, we're careful about sun protection. So you do want to spend about 15 minutes outside a day if you can, between the hours of 11 and 2. And one fun fact I do want to share, that the way that you can get some vitamin D is actually exposing mushrooms to the sun. So you can keep them by the windowsill, and they can actually absorb the vitamin D, and the plant sterols actually will convert that sunlight into vitamin D, and you can take it in that way. So that's a fun fact of mushrooms, if you can tolerate them. And then looking at the water-soluble vitamins, so I highlighted thiamine. This is really the most important one that you need from all of these. And thiamine deficiency can occur within 7 days to 30 days once it's taken out of the PN. So you really have to make sure that thiamine is being supplemented. And you can see over here that without supplementation, it can lead to confusion, heart failure, and be life-threatening. And you can see an overview here of the other B vitamins. Vitamin C is also very important. This can result in bleeding gums, easy bruising, poor wound healing. So we'll supplement these either with just a complex of B vitamins or oral medications, such as a vitamin C or over-the-counter pill. B12 is another one that can be given as a sublingual pill. So again, when you have short bowel syndrome, especially when you lose that terminal ileum, which is the site of B12 absorption, you can take all the vitamin B that you want orally, and it really won't get absorbed because you're missing that part of the intestines. So sublingual is a really nice way to get that in. You can also do IM, intramuscular injections of B12. So how do we approach the multivitamin shortage? So we want to really preserve the pediatric multivitamin for young children, especially for neonates. A lower dose of the adult multivitamin can be used for older children, but we really have to be careful when using this in young children. One, as I mentioned before, the adult multivitamin does contain a lot more vitamins, so it might not be appropriate for them. You can dose it as a lower dose, but it can actually be toxic to some ingredients that are in here, including aluminum, polysulfate 80, and propylene glycol. So what do you do if the multivitamin is reduced? You want to make sure you're taking a complete oral multivitamin daily. And complete is really the focus here. You need to understand what that means. It's really listing all of that list of multivitamins that I gave in that previous slide that are in your PN. You really want to make sure that you're taking an oral vitamin that contains all of those, and many don't. The ones that we like to use are Flintstones Complete. So this is a chewable tablet. We use this a lot in children. DECA's Plus is another great one. Prenatal multivitamin, so that can actually be used as well. It contains high doses of all of these. Can be used for both men and women. It's a very good multivitamin. Be careful with gummy vitamins. They often don't contain everything and are not complete. And when you do have malabsorption, you might actually need much higher doses of these vitamins, or you might need to divide the dose into twice a day, 3 times a day. To really be able to get to the appropriate level. And if that multivitamin is removed, you really want to make sure you're taking that oral multivitamin again. And if possible, and if they are in supply, make sure that your provider is ordering the individual vitamin components in your TPN. And again, really making sure to get that source of thiamine, very, very important. What about trace element shortages? So zinc, copper, selenium, and chromium can be added as individual components. They do come as part of the multi-trace. There are different varieties of this. And when there is a shortage, you might get one that doesn't include selenium. Selenium really is one that is required, and deficiencies can lead to cardiac problems and muscle weakness. And these can be supplemented with different types of tablets. Iodine deficiency can result in thyroid problems. We want to recommend that you use iodized table salt. It's a really good source of iodine, and there are also potassium iodide drops that you could use that are sublingual. In children, these become quite challenging because a lot of these formulations are either too high of a dose, or they don't taste good and children won't take them, or they only come in tablets. And there's a difficulty tolerating some of these oral supplements. And then electrolyte shortages. So sodium deficiency can result in seizures, loss of energy. Potassium can result in muscle cramps. Phosphorus can actually be life-threatening if you're deficient. It can affect breathing and heart function. Magnesium and calcium can cause muscle spasms. And a low bicarbonate level can result in metabolic acidosis. And you can see over here on the right some ways to supplement these. Sodium with either salt tablets or, again, iodized salt. Potassium comes in potassium tablets or a liquid. Phosphorus comes as a powder together with sodium and potassium. Magnesium comes as tablets. These are sometimes challenging. They can cause diarrhea if you take too much of them. Calcium comes as a tablet or a liquid. Another good source of calcium is actually taking Tums. It can help with some reflux symptoms, but it's also a very good source of calcium. And for low bicarbonate, I really want to draw your attention. So there are prescription versions of this, or sodium bicarbonate tabs. There's liquid Bicitra, and there's good old-fashioned baking soda. So I really recommend that everybody have this at home. If you have a low CO2 level, it's a really quick way to make sure that it's corrected and prevent having to come to the hospital. And there are additional shortages that we face. So pretty much every component that is in your TPN has been at a shortage at some point. So mentioning again what Vanessa said, the macronutrients, so that's your dextrose, protein, and fat. These are your source of calories. So if one of these is deficient and we want to continue to give you the same amount of calories, we need to make up for it in another one. So if you have an amino acid shortage and you're not able to replace it with another one, and you're giving just dextrose and fat, that leads to a huge imbalance, and it can result in fluid overload, and you need protein, so that can result in malnutrition. So when this happens, we're often able to switch to another amino acid, but it is challenging. Lipid is another one. We recently had shortages of SMOF that provides you with your essential fatty acids, your omega-3 and omega-6 fatty acids. If you don't get this, it results in essential fatty acid deficiency. You can see the consequences here. So you can have a dry rash, poor weight gain, increased risk of infection, which none of you want to have, and then impaired neurocognitive or retinal development in children, which again, we really want to try to prevent. And if you're trying to make up for the calories with dextrose, this can result in hyperglycemia or fatty liver disease. So this is a little bit tricky, and actually bothered me quite a bit what people were doing here with the shortages. They were switching to another IV lipid formulation. And some that we used to use, like the traditional lipid formulations, and these kids that have intestinal failure associated liver disease and adults that have it, we really want to try to protect their liver, and a short-term use of one of the omega-6 containing lipids is probably okay, but we really want to try to prevent long-term use of that. And then there are things that you can take orally to supplement those omega-6 and omega-3 fatty acids. So these include walnut oil, which is a really good source, canola oil or safflower oil. If you have fat malabsorption, sometimes these are not tolerated, so you can actually use these as a medication, meaning that you can do small doses divided throughout the day. You can take it as is. If you have a feeding tube, you can just inject it and flush it, or you can mix it into different food that you're eating. Another one that I put on here, which is actually not a true shortage, but it kind of is behaving like one, is ethanol locks. So ethanol locks have greatly reduced the infection rate in people that have a central line. And this occurred about 2.5 years ago, where the company that makes ethanol locks achieved an FDA approval for cardiac indication. And this resulted in the price of ethanol increasing from $10 a day to about $1,000 a day. And ethanol locks used to be just included as part of your home care package of PN. And most of the home care companies are not able to supply that anymore. And this has resulted in increased risk of central line infections and hospitalizations. So things that we can do, we've been able to find some pharmacies that can actually compound ethanol locks for us. So they take dehydrated ethyl alcohol and can make it into a 70% sterile ethanol lock solution, which can be used. It's actually very cheap to make it this way. A lot of times it is covered by insurances. Even when it's not, there is maybe like a $30 copay for a 2-week supply. So not too bad compared to the risk of being admitted to the hospital and having a line infection. And then there are alternative lock solutions. So one of them we heard about yesterday, sodium bicarbonate locks. They're antibiotic locks, which we try to avoid using on a routine basis because they can result in antibiotic resistance. And then there are kite locks, which are used in Canada, and some centers are able to get them for compassionate use. So what are some of the challenges with oral and enteral supplementation? So one, as I mentioned, if you have short bowel syndrome, if you're not absorbing well, you're not going to absorb these oral supplements well, which is why we have them in your PN. So you are going to have to take larger doses, maybe do it in different forms, such as IV, intramuscular, sublingual forms, try chewable tablets or liquid forms. And every patient is going to be different and have different absorption. And even from time to time, you might have flares of malabsorption, of bacterial overgrowth that might impair your absorption. A lot of these supplements, unfortunately, do have side effects, including diarrhea, nausea, vomiting, and abdominal pain, and they're very expensive. We treat them as physicians as a medication. Insurance companies, unfortunately, treat them as over-the-counter supplements and often do not cover them. And that is fine if you're somebody who's just taking some extra, vitamin C just to try to prevent getting sick in the winter, versus somebody who needs 50,000 units of vitamin D a day. That is really going to add up. And then ethanol locks, again, the cost, which we are trying to get the ethanol locks back. I'm not sure if that is actually feasible, though. So going back to what can you do? Again, be aware of those TPN shortages, make sure you know how to read your PN label, and you can spend time with your pharmacist or your dietitian going through this in detail, making sure you understand all of the components. Let us know if something looks off to you. So we all work as a team, so let the pharmacist know, the dietitian, whoever is prescribing it for you. Let them know if something is off or if you have any questions. We have to monitor your blood levels frequently, so there are risks of these vitamin deficiencies. There are also concerns for toxicity. So if you're taking supplements that you bought over the counter, you have to make sure they're appropriate for you and not overdose on vitamin A, for example. That can happen when you take the DECA supplement if you don't need that extra vitamin A. And that can actually cause some liver fibrosis. So really take these oral supplements as directed by your healthcare provider. Make sure that you're compliant with them. If you have challenges with compliance, if taking it 3 times a day, talk to them about what you can do. Maybe you can do a high dose once a day or a different formulation that has better absorption or a higher dose. But really treat it like a medication. The same way if you wouldn't miss your dose of loperamide because you know you're going to have diarrhea, take your oral supplements because you're going to have consequences if you don't. And another important thing to remember, when these shortages are resolved, you have to go back to normal. You don't want to keep taking all of these extra supplements that you might not need. And then working with the FDA. So the FDA can help in getting temporary importation of foreign source medications. They'll do this if there's a critical shortage. And if US manufacturers are unable to resolve the shortage, it does take time to get it imported. It gets held up sometimes in customs, and just shipping it takes time. Shipping by air is more expensive. By sea is cheaper, but it can take a long time to get it. And then advocate. So we are here to help you do this too. And HPN really needs to be recognized as medically necessary and critical to your health and survival. And there's several organizations here, including ASPEN, the American Academy of Pediatrics, the National Pediatric GI Association, the Pharmacy Association, ASHP, of course, the Oley Foundation, the FDA. Talk to your elected officials and reach out to your media because this can make a difference and increase awareness. So your bowel might be short, but your drugs should not be. Thank you, and we will open it up to questions now.
Thank you, ladies, for that. I'm sitting here asking all sorts of questions in my head. We do have quite a few questions. We won't be able to get to all of them, so I apologize. The ladies will try to answer in the Q&A question section later if we don't get to yours. So one of the questions on here that I thought was very interesting, it says, if you can't get lipids and you do still test in a normal range of essential fatty acids, is there still concerns about not getting the lipids, or do you think you're getting it enough from other sources?
I can take this one. So if you are getting eating by mouth or getting enteral tube feeds, you might be getting enough and absorbing enough. So you might not need that lipid. And not everyone who requires parenteral support requires lipids. So it's really important just to monitor for essential fatty acid deficiency, make sure that your weight is stable for a child, make sure that they're growing and developing appropriately. Those essential fatty acid profiles are not always the most accurate. That's an issue for another day, but just be aware of that and talk to your provider and just make sure that you really are getting what you're supposed to.
Absolutely. So you keep mentioning, both of you guys mentioned about labs and things. So obviously there's, the macro, the micro, the trace and all that. Are there some general guidelines of how often these should be pulled, especially in the category of during shortage times?
Well, it really depends on the component, the nutrient. I feel like it really needs to be individualized. And just as one caution, I'm going to use calcium as an example because I see this a lot with having this calcium shortage. is that people were monitoring serum calcium levels as a way to assess, well, if the level is normal, then there's no, what's the harm by not providing it? And that's erroneous. And, you know, because then it comes at the expense of pulling calcium from your bone in order to maintain this normal serum level of a calcium. So how do you know? I mean, then it's a year down the road. What are you going to check a bone density? I mean, there's no immediate way to monitor that. So yes, we need to monitor labs. The frequency will depend on the component, but don't let that give you a false sense of security that there's no harm, because we can't monitor the impact of all of these nutrients when they're not provided in the PN.
Interesting.
Right. Very important point.
So
I would just like,
go ahead.
just like to add one thing. So that's also true for some of the B vitamins. So measurements are pretty useless for those as well, like B2, B3. And some of these tests also cannot be checked at home. So you might not be able to realistically monitor for all of these. And that's why when we know that there's a shortage and we're not able to provide it, just make sure you're supplementing. And some of these you can't overdo it.
So I got lots more questions and they do too, but so this could just turn into a personal session with me and you guys if you want some time, because I've got questions. But is there a typical, like a more typical way? I know every team is different, but because I have both of you guys on here, like the pharmacist at the DME versus the ordering provider, and who's going to who typically leads or directs these conversations more, or is it just totally up to the providers?
Well, I feel that whoever is the supply, where the supply is coming from, if it is a DME, which is interesting because there was a question regarding heparin locks. You know, some of this is pharmaceutical and some of these are supply items. You know, heparin lock is actually considered a supply item. And the source for some of these, it really depends. But if it's coming from your infusion pharmacy, they really are going to be your point of you know, bugging them if that's what it takes to keep up with, so that they're keeping up with supply and keeping you updated as well. So there's a lot of times, you know, it is a lot of, you know, you're going to maybe not be the most popular person because you're going to be bugging them about it a lot, but that's what it takes. They need to know that it's important, and they can't just, you know, it can't just be a casual thing whenever we get it back in stock. I mean, I think it takes, I feel it takes the patient, the consumer, the caregiver. You guys have more power than we do as a provider, really, frankly. It really coming from you, especially when it's those supply items, and then finding an appropriate alternative. I feel that it's that end user who's going to be the best advocate, best ability to be the advocate.
Thanks.
Because, right, there's always another option. You could switch pharmacies, right? I mean, that's ultimately in your power, and you can use that card.
Yeah, and we've had that happen where some of these shortages will only affect one of the home care companies and not the other. And we don't like to switch companies, but if we have to ensure your safety, that's definitely something that we can do.
Well, we have time for this one last question. I'd love to hear the answer to this one. And sorry, we didn't get to all the other ones, but it's very costly for a company to come back out of a shutdown. The collaboration with the FDA would be really help bring drugs back faster. So how do you see building that relationship between manufacturers, FDA, patient, and so forth going forward?
I think one thing that actually Oley helped with recently is we had an FDA listening session, which was really excellent. I was privileged to participate in that as a clinician, and we got to hear from a lot of patients and caregivers who really shared their experience with the FDA. And they actually told us it was the biggest turnout they've had for one of these sessions. So I think there is interest on their side to learn more about short bowel syndrome and intestinal failure, and to continue to work with us. But they need to be aware of these things and how much it impacts you. And again, that these are not just supplements that we are giving you, that these are really medically necessary components.
You know, there is some legislation out there to try to help mitigate shortages. It's a tough situation. I do feel that, you know, Aspen plays a role there, obviously Oley, you know, there is that advocacy in place, but it's, there's no quick, easy answer. And, you know, even trying to import from other countries is not always feasible, because everyone, I mean, this is a global issue. These product shortages are impacting it, you know, it's global. So it's not, in the past, we've been able to import, you know, from Canada and from Europe, but it's not, that's not even really a feasible solution right now. So it's, but I agree, the government, you know, advocacy is an important part looking forward, because these shortages are not going to go away, and we need to continue to have a voice and make it known that it's a problem, and to do what we can.
Yeah, and the way that it stands now, manufacturers are not even required to let us know how long these shortages are going to go on for and what plans they have in place. So that's another place where the FDA and maybe government can help to push these companies.
Absolutely. Well, first of all, thank you, Vanessa and Sivan, for spending time with us today.